depend on it.
This is Scott Slade from Atlanta's Morning News on WSB. Our 24-hour news center is delivering updates 4 times an hour all weekend. You can depend on it. And we'll be here Monday morning, 4:30 to 9 with breaking news and traffic and weather every 6 minutes when you wake up. News 95.5 at AM 750 WSB. Now, back to Belinda Skelton.
And welcome back to Atlanta Living. I'm your host, Belinda Skelton. Thanks for joining us on this Sunday afternoon. I'm actually, when I leave here, I'm going to start making jambalaya. So, I watched Ina Garden make it on the video. So, how hard can it be?
Right.
It was a lot of chopping.
Looks so easy.
It looks so easy. A lot of chopping. I can chop. So, listen, follow me on Twitter and Facebook because I'm going to post how I do with this endeavor, and I'll let you know how it turns out.
If you cut your finger, give me a call.
I now have your cell phone number, Dr. Cox. Be careful what you say. That is the voice of Dr. Paul Cox with Oculus Longevity, and he is here because, folks, we have all griped, there's another word I want to use there, about health care. And we get frustrated with how much time our doctor spends with us, but they really can't spend more because they have to see so many patients to make a living. And from that has morphed this new level of medicine called Concierge medicine, and it's where your doctor can see more of you and really get to know you and your true health care needs. They charge a flat fee a lot of times, and you still have to have insurance. Let's make that clear.
Yes.
You still have to have insurance, but they charge a flat fee. There's different levels that you can choose, and they are at your beck and call.
Yes.
Did I sum that up?
Yeah, I think it's great. All I would add is that, it's not like some folks actually do home visits and things like that. I don't do a lot of that, although I've gone to the office on my off day to meet somebody because there was an issue. What it really comes down to is our goal is to make you as healthy as possible so that you don't need us very much. But, I have younger patients. I have a lot of patients who travel a lot. And if they're in California or if they're in New York City and they're really busy, they can call me and say, hey, Paul, this is what's going on. Do I need to go see a doctor here? Can we do this over the phone? And a lot of times it's something we can handle over the phone. I can call in a prescription to LA or I can call in a prescription to New York, and we get them taken care of. And it's this continuity of care. It's seamless. And so they don't have to stop and then go to a doc in the box or one of those minute clinics or something like that. And it completely ruins their day and productivity.
Exactly. And their past history.
Exactly.
So that makes a huge deal.
Yeah.
Okay, let's go to the phone lines. And if you want to join us, 404-872-0750. That's 404-872-0750. Cheryl in Jefferson, you're on WSB. You want to talk to Dr. Cox?
Sure. Hi, Belinda.
Hey, sweetie.
Hi, Cheryl.
Mm-hmm.
Mm-hmm.
Put a Band-Aid on it.
Yes.
Right. Getting in front of it instead of getting behind it. So that was what really caught my ear rather. My question to you is, how much do you bring in the natural therapies in conjunction with mainstream medicine, and then where are you located?
Oh, great question. So here's the thing. I've done a ton of additional training that is in the field of integrative medicine. And what we do in integrative medicine is a lot of times we use natural things. We use vitamins, we use supplements, we use herbs. And all those things have been shown to be really effective. And there's a lot of great medical evidence that shows those things can be effective. Now, do I know my way around a pharmacopoeia? Yes, I know how to use medication. I've done it for years. But my practice, we usually try to do something that is more on the natural side first.
I'm not going to bring up the day you made me wear a garlic rope. Here nor there.
I really didn't do that, I swear. But we try to use natural things first because there's some great data behind things like fish oil, vitamin D, niacin, which is a B vitamin. There's lots of things that we can do to get us healthier that don't necessarily involve drugs because every drug has a risk-benefit profile and the side effects may be worse than the benefits. So we have to take those things very seriously. As far as location, I am in the Buckhead area, Sandy Springs area. We're located at 5505 Peachtree Dunwoody Road, Suite 630. You can reach us by calling my wonderful front desk person, Beverly, at 404-843-3636.
And we'll put up all this information on my website, belindaskelton.com, which you should already have bookmarked on your computer. But this will all be up tomorrow. All
Thank
right.
you. Good talking
Thank
to you,
for
Cheryl.
your call, sweetie. Okay, bye-bye. Let's, we had a call, Dr. Cox, that dropped off. Let's see if you can answer it real quick. They wanted to know why specialists in medical fields, why won't specialists in medical fields allow nurse practitioners or PAs to refer patients out to different things and only doctors can?
Well, that's an insurance billing issue, actually, Belinda. What happens is when a doctor actually makes a referral to another physician, the physician that has been referred to can charge a different level of service, so they get a higher reimbursement rate for that visit. But also that brings up something else that's really important, is that the reason a lot of folks are now seeing nurse practitioners and PAs is because there's a shortage of primary care physicians. Not because we're not training enough physicians, we are. But the average debt of a medical student coming out now is over $200,000.
Oh, God.
And frankly, they can't make enough money as a primary care physician to pay off their debts and support their families. And so nobody's going into primary care because they need to specialize.
I don't doubt it that people are finding it hard to find a primary care physician, and that doctors want to specialize, because if you're seeing, you said before you started specializing and becoming a concierge physician, you were seeing 14 patients before lunch.
Yes.
I mean, the burnout factor there has to be huge.
Well, it's incredible. And if you look at lifetime earnings, a specialist will easily earn $3 million more over a career than a primary care physician. And so it's just really tough because a lot of the training's the same, a lot of the demands are the same, the stress a lot of times is the same. But you go into primary care thinking you're gonna save people and you're gonna help them, and you find out that you've only got 15 minutes to do it, and you just can't do it.
Bureaucracy is
Yes.
killing the industry.
It's really tough. It's really tough.
Insurance. Oh, okay. So let's go to the phones and speak with Ray. Ray, you're on with Atlanta Living. How are you today? Good morning.
Oh, great. Thanks, Ray. I do not have, I'm not trained in chiropractic. I don't do any of that kind of thing, although I do have very reputable chiropractors that I will refer to. And so if my patient wants to get into chiropractic care, I know a couple of great folks that I refer them to. All right. Thanks,
All
Ray.
right. Thanks for your call, Ray. I think that's what he was asking. Do you incorporate chiropractic care?
Yeah, we don't have it at our clinic, but
Okay.
we refer out.
So you have kind of a side specialty, Dr. Cox, that you are passionate about, and that is hormone treatments for male and female.
Yes.
And it's always a hot topic here on the show because I think it's something that affects everyone, especially as you get older. And I don't mean older. I'm talking 40s.
Yes.
And although you get blood work and they say, oh, your hormones are fine, hormone tests are so specific and so sensitive. You have to be testing for the right hormone.
Right.
There's T1, T13, T1. So that is something that you really need to be going to the right doctor.
Yes.
To get the right test.
And something I'd like to make a point about too, really quickly, when somebody tells you that your labs are normal, remember, normal is based on the population on which the labs are being performed. So if 66% of America statistically is overweight and 50% of America is either pre-diabetic or diabetic, if you're normal, you're fat and sick.
You're right.
Don't be normal, be optimal.
Yeah. So this is another perk to your practice.
Yes. Yeah.
So I want to stress, folks, if you are sick and tired, get the pun, of the way that your practice is treating you, whether you go to Dr. Cox or you seek out another concierge service
Yes.
from another doctor. Just try it out. Just do a little research, because I think you will find that it is a really an eye-opening experience and a new way to treat yourself and your family, because they truly get to know you and your healthcare needs. And like I mentioned in the beginning of the show, it's bringing small town medicine to the big city. It's the way it used to
Yes.
be. All things come back.
Mm-hmm. It's been wonderful, and I'm so happy, and I'm so grateful to my patients. I'm finally doing now what I always thought I was going to do, and it's amazing.
So, Dr. Cox, is there a case, I'm putting you on the spot here, is there a case that comes to mind where someone was misdiagnosed, mistreated because they were given 5-10 minutes in a doctor's office, and then they came to you and y'all had this aha and discovered what the main problem was, and they were fixed?
Well, one of my favorite stories is a story about a gentleman who he is a captain of industry. He owns an extremely successful company, travels a lot for work, works really hard, demands a lot of himself, demands a lot of his company. He came to see me a couple of years ago. He was severely overweight. He'd been basically a gym rat, a weightlifter for years and years and years, but things had just gone the wrong way. And we sat down one January. I said, okay, this is what we need to do. We need to get a plan for you. We've got to get this fixed. All right. This gentleman lost 130 pounds
Wow.
in 1 year. He learned how to cook because he never knew how to cook before. He was eating out all the time, and he wanted to eat healthy.
Yeah.
And at the end of that year, he went on his first date in 20 years.
Gosh, that's life-changing.
It is. It was fantastic. And all we did, we talked about things. I encouraged him. We gave each other the space to create this relationship where we supported each other in getting done what he wanted to get done. And it was amazing.
Setting goals.
Yes.
Okay, Dr. Cox with Oculus Longevity, thank you so much for joining us in the studio.
Thank you, Belinda.
Okay, you can, what is the website?
It is oculuscosmetic.com.
That sounds great. Okay, folks, I'm giving away the weekend prize pack, 4 passes to the advanced screening of Universal Pictures, the new film Steve Jobs. And that's going to be on October the 12th at Regal Atlantic Station, and a $100 gift certificate to Marlowe's Tavern for the annual Ribs and Whiskey celebration through October the 19th. Callers to 404-741-0750. We're going to take callers number 1 and 2. Stay tuned at Breaking Choose coming up next. Ooh, that was awesome.
That was fun.
AALA